Manitobans fully vaccinated, and so this is continuing our path to a post-pandemic Manitoba. So I encourage Manitobans to continue to get vaccinated as soon as you become eligible. We know we have some Manitobans that still are hesitant. I encourage you to speak to your healthcare provider to get information related to that, to answer any questions you may have, because the more and more Manitobans that become vaccinated, the sooner we'll be to that post-pandemic Manitoba and continue those plans to move forward. My recommendation is a strong one and clear, is that all eligible Manitobans should be vaccinated as soon as they become eligible, and that's 2 doses. We're getting more and more Manitobans vaccinated with each passing day, and which means we're getting closer and closer to a post-pandemic Manitoba with each passing day. And again, in that post-pandemic Manitoba, this is going to be a Manitoba with public health guidelines rather than public health restrictions. This Manitoba will not be reporting cases daily of COVID-19, so we need to start adjusting and getting used to not hearing daily case counts on COVID-19. We know COVID-19 is going to still be with us in a post-pandemic Manitoba, but things like daily reports of test positivity, case counts, are just something that won't be part of a post-pandemic Manitoba. We need to get back to living with respiratory viruses. We know there will be a resurgence of influenza and RSV this fall as we again have more and more interactions as we move away from public health restrictions. So we're going to see respiratory illness. We're going to see a strain on the healthcare system like we do in respiratory virus season, but we have to get back to living with those viruses, taking precautions, still following public health guidance. There may be individuals who are more at risk or know people around them that are more at risk of severe disease. They may take extra cautions. But it will be up to us to follow public health guidance, to accept the level of risk that we may be personally willing to accept. But moving forward, again, we're moving away from public health restrictions, more to public health guidelines and recommendations. And that's going to include information that we've all been aware of through this time, that outdoors is much less risk of transmission compared to indoors. When we are indoors, ensuring we have good ventilation, keeping windows open if possible, things like physical distancing if possible, wearing a mask if you can't physically distance. Smaller group sizes are safer than larger ones. Fewer contacts outside your household are safer than large amount of contacts outside your household. And again, our best protection for ourselves and the people around us is to be fully vaccinated. So again, I'll end with that clear recommendation. The more and more Manitobans that get fully vaccinated, the sooner we'll be in post-pandemic Manitoba. The sooner we'll get back to the things that we all love and enjoy and have missed out on for so long. So, so thanks again, and happy to take some questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Sun, Scott.
Hello, good afternoon, Dr. Roussin. First question, looking over the epidemiology report from this week, it shows last week there was a significant spike in daycare, I guess clusters or outbreaks, and that number increased again this week. What are you seeing there?
So we're seeing, still COVID-19 is going to be with us. It's going to be with us through the fall. We're going to see transmission occurring mostly within the unvaccinated, and then we're going to see severe outcomes, almost exclusively in the unvaccinated. And so we see clusters related. We've seen clusters related to Delta variant, but what we've seen is that we haven't come across many severe outcomes within those clusters because there's such a high uptake of vaccination within those clusters. So we're going to still see COVID-19. This fall, we're going to see RSV, we're going to see influenza. And so it's just getting back to living with these viruses, and vaccine, both COVID vaccination and coming this fall, influenza vaccination is going to be our best way to protect against those severe outcomes.
All right, thanks for that. We're a week away, or a week out from the new restrictions, and a week away potentially from, well, we're from that 2-week incubation period. If we don't hit 80%, I mean, given our numbers are so low and they keep going down, you know, it continues to be favorable here. Could we see another loosening of restrictions coming, even if we're not at that 80% mark, just given how low our numbers appear to be at the moment?
So we don't have any final decisions with this. Like we always said, we look at a number of indicators. We really recognize that vaccine is our way through this pandemic, and so we really want to encourage Manitobans to hit those targets. So we're going to continue to shoot for those targets. We don't have a final decision on when these next loosenings will come in. It's going to be based on a number of indicators, but vaccine is so important that we really want to hit that target.
From CBC Radio Canada, Charles.
Hi, Dr. Roussin. On the plan, you have to help students get back to school safely. It seems like some school boards want to know more about it shortly. They want to know more about the bus drivers they will need. Some school boards could be forced to hire several new drivers at the last minute before returning to class. So, what's the plan you have to help students get back to school safely, but also considering other aspects such as the vaccination, social distancing, and wearing a mask?
Yeah, and so we know the return to school is so important. It's always been through this pandemic. We've always had the stance that schools would be the last to close and first to open whenever we had to have restrictions. And our goal is really to get the kids back to school as normal as possible this fall. And so we're going to have more details on that shortly, but I don't have those details right now.
Perfect, thank you. A second question. Should young people between the age of 12 to 7 years old and also all school staff be all vaccinated before returning to class?
Well, so certainly the recommendation is absolutely everyone who's eligible to be vaccinated should be vaccinated. So that's a clear response. If everyone, the higher proportion of people vaccinated, the safer any activity is going to be. So it's certainly a recommendation. We don't have plans to have a mandatory vaccination for schools. But certainly, the more people who are vaccinated, the safer it's going to be. The more people who are vaccinated around those who cannot be vaccinated, the safer it'll be. So the recommendation is just clear: is that we need to hit those vaccine targets. That's our way to get back to normal. And so we do need people to get vaccinated as soon as they become eligible.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Okay, so we're seeing pretty good vaccination rates, but we're still seeing this great disparity, and a couple of health districts just stand out. In 1 week, Stanley Health District went from 20.3% with 1 dose to 20.7%. Winkler nearby went from 36 and change to 37 and change. We're not really seeing significant movement. Suggests that Delta, when it gets there, those places could have a really bad effect. As Tom suggested in the Freep over the weekend or whenever that was, why not enact tougher restrictions in those areas, seeing as people there aren't protecting themselves?
Yeah, and so I think that moving forward, it's very likely we're going to see COVID as a transmission occurring in the unvaccinated. and we're going to see the severe outcomes in the unvaccinated. So we're going to still see transmission. We're going to still see severe outcomes, and that's going to be mostly in the unvaccinated community. So, our messaging right now, we're doing a lot of work on outreach, doing a lot of incentive work right now to try to get those rates up everywhere. When we see low rates, especially clustering geographically, it does put us at risk for that fourth wave. We've looked at and have had in the past local restrictions, and so nothing is off the table. But just at this point, as we move to loosen things where we have so far moved as a province-wide. But again, nothing's off the table when we're looking at protecting the health of Manitobans.
All right. When this is all over, you're not going to count the nothing's off the table comments. You know that, right? The Delta modeling. When will we see it?
Yeah, and so work's been ongoing on that for quite some time. Again, the number of calculations that are run on these. There's this agent-based modeling, right? We don't just use extrapolation data. So we're working on that. I believe in an upcoming week or two, we should be able to have clear Delta modeling. And then again, what I mentioned is that this fall. We're not going to be dealing only with COVID. We're going to be dealing with RSV and dealing with influenza. So we're trying to look for ways to model or at least come up with some scenarios with what this respiratory virus season will look like, because that's what's going to put the pressure on the acute care system, not just COVID.
From the Canadian Press, Kelly.
Hi. So apologies if this has been spoken about prior, but building off Bart's question, where are we at with Delta in Manitoba? I think a lot of regions across the country have now said it's the dominant strain. So is that the case here? And if not, obviously you haven't released the modeling yet, but is that projected for soon?
So here, our dominant variant is still Alpha, making up over half of our cases. Delta is climbing. And it's depends on on the region, and of course we see certain clusters that are related to it, and so we're looking about 30% of our cases are related to Delta, and that's climbing, and so we expect that to become our dominant strain, just like what we've seen in other regions. And there'll be more to come, more details to come on with once we have that Delta finalized in our modeling.
And we're seeing an uptick in cases in Alberta, specifically in Calgary, among younger people, just a few weeks after restrictions were lifted and right after the Calgary stampede. So what lessons are you learning from this as Manitoba moves into further stages of reopening, which, will eventually allow for these kinds of large events?
Yeah, and so what we've been saying is that COVID-19 very likely moving forward, and as what we see right now, is going to be a disease of the unvaccinated. And so we're going to see transmission occur. What we're really interested in, what we've always been really interested in, is the severe outcomes. And so when the unvaccinated in the younger age groups tend to have less severe outcomes, although we do see severe outcomes in in the 20s, even younger, but less common. And so moving forward, we have to expect as we loosen things, we're going to see more and more transmission. We're going to see outbreaks. We're going to see clusters. We're going to see a resurgence of RSV and influenza. That's just the nature of interaction. When we interact, we see transmission of these highly transmissible viruses. So we're going to see more and more cases. What's important is that going to translate into severe outcomes where we see strain on the healthcare system? So, moving forward, like I said, our best way to limit that is through vaccine, both COVID-19 and influenza.
From CTV Winnipeg, Jeff.
Oh, hi, Dr. Roussin. So if this is obviously, like you say, the disease of the unvaccinated, are you concerned about, schools just over a month away, and we will have a large segment of the school population not eligible for the vaccine, and we have the Delta variant, as you've mentioned. Are you concerned about the impact on young people going forward?
So we know that getting the kids back to school in as much a normal fashion is quite important. When we have pockets of unvaccinated, and here we're looking at people who are not yet eligible for vaccine, the best way to protect against this is to have the eligible people around them vaccinated. So we know the younger children are much less likely to have severe outcomes. They're also less likely to be high transmitters of the virus. What we need is people at home to be fully vaccinated. So if that vaccine, if the virus is brought home, it's brought home to a family that's fully vaccinated with everyone eligible there within the school. If we have staff and eligible students vaccinated, we're going to see much less transmission occurring in those areas. So it all again comes back to high vaccine uptake in our eligible populations.
I know you say there's more details coming, but is it safe to expect, should parents, teachers, and students expect, as the school year begins, because we have that group under 12 not vaccinated, that we will still have cohorts, like mandated cohorts, mask use, separation between students in schools? Should everybody be expecting that again?
I'm not going to comment right now because I think we're still looking at different scenarios. Of course, we work with a lot of partners at the national level, looking at guidance and what's going to be taking place. So I just suggest we'll wait for another a week or so, and we'll have more information then.
From CHVN, Taylor.
Hi, good afternoon. Looking at our vaccine rates and our low test positivity rates, at what point does Manitoba move from being in the pandemic to a post-pandemic Manitoba?
Yeah, and this is really the path that we're on, and we're moving to that post-pandemic Manitoba. And again, to be clear, that's not a post-COVID Manitoba. We're going to see COVID for the years to come. It's just that we're going to move to a Manitoba without public health restrictions, more guidance, and less time spent reporting on COVID numbers because it's endemic rather than a pandemic. So when that actually occurs is not settled as of right now, but we're certainly ahead of schedule on reaching there. We've been ahead of schedule on our last 2 loosenings. We're going to be ahead of schedule on our next set of loosenings, and so we're certainly on that path, and that's where we're headed in the near future.
And along those lines, we still have those QR codes as proof for being fully vaccinated. Is this something that's going to stick around even after the full reopening?
Well, again, we don't. I'm not going to speculate right now exactly on what we're going to be dealing with come fall. Certainly the goal was that this is not a permanent issue. This is when we're dealing with this virus right now. We have a highly effective vaccine, so we wanted to encourage uptake. We wanted to be able to open things sooner and safer, and the way to do that is when we have only fully vaccinated people attend higher risk settings. The plan was never to have this permanently, so at some point we're going to be exiting that strategy. But there is no date on that right now. We need to again follow what we see here in Manitoba.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Roussin. So we know the Delta variant isn't dominant in Manitoba, but because we don't have the province's modeling yet, what do we know already about the effects that the Delta variant is having on infection rates and health outcomes in the province?
Yeah, and so we know it's becoming more and more common. So it's certainly climbing the proportion of new cases related to Delta, so that's climbing over time. We expect that to continue to climb over time. It has the advantage of being more transmissible, so it's going to be our dominant strain here in the near future. We're seeing clusters related to it. We're seeing clusters that involve fully vaccinated people. However, in those clusters, we're not seeing severe outcomes in those fully vaccinated people. So it is, following what we already know is that it's much more transmissible. It may be more severe to the unvaccinated, but vaccine, especially being fully vaccinated, is quite protective against severe outcomes.
And provincial data shows that most COVID cases are among men in their 20s. Why is this group experiencing the highest number of infections?
Well, there's a number of reasons that could be. Again, we typically have seen the vaccine uptake amongst males at all age levels typically lower than that of females. We know vaccine uptake in the younger ages is lower that of the older ages. So, I think that it's as we move forward, this is going to be a disease of the unvaccinated. And so it's just another reason to continue to encourage all eligible Manitobans to get vaccinated as soon as possible.
From Global News, Rosanna.
Hi, Dr. Roussin. So Alberta's school year plan offers some flexibility information in terms of scenarios, and I know that this province's plan is forthcoming, but can parents expect various contingency plans and scenarios to be laid out for the reopening plan?
Well, I think that when we look at our response overall, we have to have an ability to be flexible and respond. So we'll definitely have the ability to respond to outbreaks, respond to changing epidemiology and this nature. So we know this fall there's some uncertainty. We don't know exactly what this respiratory virus season will look like. We have a strong likelihood of a resurgence of the typical respiratory pathogens we see. And we know that COVID is still going to be circulating, especially amongst the unvaccinated. So we're going to have plans that are flexible. But what we do know is we want to do whatever we can to get the kids back to school and to keep them in school with as much normalcy as possible.
Thank you. You've previously said Manitobans should follow the guidelines we have in place here, even when they're traveling out of the province. So with restrictions loosening and more vaccinated people being able to travel a bit more, do you have any updated advice for people who are planning to travel around Canada and abroad?
Yeah, I mean, I think if you look at the sort of the guidance that we have, right, staying home when you're ill, washing your hands, maintaining physical distance from other people, especially if you don't know their vaccine status, wearing a mask, indoor public places is an option. So, I think overall those are still good recommendations moving forward. They're guidance. And so I think we should all pay attention to our fundamentals, especially moving into this, again, uncertain respiratory virus season coming up. And then I think, again, if we're going to be ahead of our reopening plans, and so even here, our guidance is going to loosen and change over time, and probably within the near future. So this will be less and less important of a topic.
From the Brandon Sun, Colin.
Good afternoon, Dr. Roussin. With several communities having been evacuated due to wildfires and lots of firefighters out doing the work to curtail those fires, how are COVID-19 procedures and rules being followed or enforced in these cases, either for the evacuees or the firefighters?
Yeah, and so there was a lot of planning up ahead. We know we deal with these issues every year. We're not sure of the magnitude, of course, every year, but there was contingency plans in place to ensure that appropriate isolation was available if necessary, testing was available. We had a number of procedures in place to ensure that that COVID was being considered in all these cases.
I was taking a look earlier at the reported public exposures in Prairie Mountain Health, and that list hasn't been updated since May at this point. Does that mean that there have been no public exposures, or just not ones that the province has determined to be a risk to public health?
That's right. So we would just be since the beginning, we would report public exposures that we thought posed a risk to the health of the public, and we were not confident we could just reach everyone through the typical contact tracing process. So there could be exposures there where we either felt they were low risk or we were able to reach all the contacts anyways.
Our final reporter this afternoon from CJOB, Skylar.
Hi, Dr. Roussin. Thanks for your time. It doesn't sound like the province is planning to mandate vaccines for teachers and other school staff at the moment, but I'm just wondering if you could speak to the personal responsibility aspect of it. I know in my own case, I do a lot of sitting around at home and that's about it. But if I have a teacher friend who's, going to be in a room with 20 to 30 odd kids who are unable to get vaccinated in the near future, it seems them getting their shot would hold a little more weight than myself getting mine.
Yeah, so I think in general our advice is just all eligible Manitobans get vaccinated as soon as possible, get fully vaccinated. We know that certain Manitobans carry more responsibility, and healthcare workers we've seen that's an obvious example. We see in areas, like I said, where we have high levels of unvaccinated people, and in schools this is one that is because many of the kids will not be eligible. So it's really important that everyone who is eligible get vaccinated. So my advice is the same for everyone. But people who are going to be around unvaccinated people who could put others at risk, that's even more important.
Thank you for that. And, 11 cases is a fantastic number. It's our lowest since mid-September, according to one of my colleagues. But the test positivity rate, at least in Manitoba, seems to have plateaued around that 3%. Just given the strategy with asymptomatic testing and the amount of tests you're seeing coming in, do you see that just kind of being where we're going to be at, for the foreseeable future?
We'll still see that probably going to be declining. I think really we're dealing with lower test volumes just because we're probably not seeing a lot of respiratory illness right now in general. So the test positivity is still remaining at about that 3%, but I think that will be coming down. We see that coming down in the Winnipeg area. So, overall, that's going to continue to trend down, I believe, through the next number of weeks. And then again, when we get into a post-pandemic Manitoba, we're going to have to consider what testing looks like in that post-pandemic Manitoba. Certainly when we see a lot of respiratory illness in the fall, pre-pandemic, we didn't do a lot of testing, right? Most people with respiratory illness go undiagnosed. They're managed expectantly, managed just at home. And so as we move forward, we're going to have to make some decisions on testing recommendations and just how much testing will be going on during this next respiratory virus season.
Thank you, Doctor. This concludes today's media briefing.